Hi, everyone. My name is Amy Cueva, and I'm one of the founders of Mad Pow, an experience design agency. I also oversee our health practice, where we work with clients across the health spectrum, from nonprofits to government to insurers to hospitals to healthcare technology companies. And we help them improve the quality of interactions that their consumers and their patients experience. And in the process of doing that work, we found that there are some needs that no organization specifically owns because it falls outside of the typical areas of ownership in the industry. And this is how I got turned on to unmet needs. I'm very passionate about the topic, and I think you'll see in my presentation a lot of familiar themes from what you've experienced today, which I think is a good thing because I think it's indicative of the momentum and the energy and all of the information sharing and collaboration that we're experiencing. I am a designer. I think that we're all designers. We engage our empathy, we envision a better future, and we're collaborative in our mission to get there. I believe design is powerful. I believe it can improve the human condition and that we're measured by our impact on humanity. Recently, I conducted a research study with some patients and talked to one gentleman who was recently diagnosed with congestive heart disease, and we can call him Jim for our purposes here. In talking with him about how he was learning about his new condition and what steps he was taking to change his lifestyle, he told me about the experience of being diagnosed. He told me that he was overwhelmed, he was confused, he was alone. He didn't feel like there was anyone for him to talk to. He didn't know what he should do first or what he should expect. I instantly felt for Jim. I felt like I was there with him when he was diagnosed. I felt like I was there with him when he stopped really listening to the doctor because his mind was racing. I wanted to make things better for Jim, just like I would want to for my own father. And I thought to myself, why is it that in this health system, we're not able to guide Jim through this very important transition? He's left to find the resources on his own when we know where they are. He's left to change his life on his own when there are tools and resources and patient support communities that could possibly help. He has no one to talk to when there's so many that care about his success. I started to squelch these emotions. Emotion has no place in business, right? That's what I was telling myself. But I began to think about what role emotion plays in the solutions that we create. I do believe that well-being is the foundation for health, and that emotional intensity can be an indicator of an unmet need or an at-risk individual. Basically, emotion matters. Jim's emotion as the patient and my emotion as a designer in this system. The pain, the anxiety, the frustration are all things that we should pay attention to because they're hints and clues to what is really going on. It's in our best interest to help Jim. The success that Jim has, the more successful he is, the more likely we are to achieve the outcomes that we're looking for. This isn't idealism. This is good business. So I started to think to myself, who do I know? Who do I know that could possibly help Jim? And I started to think of going through the mental Rolodex, and I thought of somebody I knew in a hospital, and I called them up, and I said, we have to help Jim, recently diagnosed, walks out of the hospital, mind racing, Googles, has a pamphlet, no one to talk to. We could do something. We could create a recently diagnosed center, the website, and we could pull together all the resources and tools and information that already exist. And maybe they could talk to a person. Maybe they could call them whenever they have a question. And the person told me that the need is not their responsibility at the hospital, nor one that will be mitigated anytime soon in the industry. Now, thinking about this, maybe this person is uncomfortable with change. Change is hard. Maybe thinking about the website and it's focused on patient acquisition, and maybe recent diagnosis really doesn't factor into the roadmap for the website. Maybe the patient portal is too hard to affect. Maybe he's thinking about the release cycle. But whatever the case may be, this need had no place at that hospital. So I started to think about, okay, if the hospital isn't, it isn't in their area of responsibility, then who could help? There are so many different entities in the health ecosystem. Each has its own unique objectives. However, we have shared objectives to prevent that amputation, to reduce this person's anxiety, to help this person live a more energy-filled life, to prevent that heart attack. And we can gather together around those shared objectives. So I started to think about, I don't just want to design an interface. I want to design how organizations and people interface with one another. I want to design an ecosystem focused on care. I do believe that divided we stand, united we stand, and divided we falter, that we're stronger together than we are apart. So, I took these ideas, we need to take an open source API approach to business, and I talked to a government representative. It's all about integration and platforms, and how do we link up programs and services, and this is what they said to me. You think partnership is the answer? Many people have spent a lot of time and money trying that. It simply won't work. Now, I know many of you know that it is starting to work, which is fantastic. And I give him the benefit of the doubt in terms of when we do something and we try really hard and fail, we can become jaded. However, there's knowledge in failure. There's information that we can take forward to help us be successful, and it doesn't mean that we have to give up. So what I heard was no. Nope. I've never liked the word no. I think that no halts thinking. I think no is a barrier to innovation. I think no says stay comfortable, don't change. I think a better question is why? Why are things the way they are? Or better yet, why not? Why can't we envision a better way? This slide's familiar, you saw it earlier in somebody else's presentation. That's the theme, envisioning a better future. Or better yet, what if? What could we accomplish if we linked together resources? If we pooled together resources and forged new partnerships, what could we achieve? So as you can tell, I'm very passionate about this topic of addressing unmet needs, and I wanted to stand in front of you today with all of the answers. Here's how you identify them, and here's how you address them. And I had to be very patient with myself in that because I don't have all of the answers, but I am fascinated by this topic, and I think we're just scratching the surface. And I'd love to hear what you all think about it as you discover new things. I do think there are a few considerations. We need to allow ourselves to feel. I think that emotion holds the key to understanding people, where they need support, and situations that need our attention. I think in service and in business, sometimes we're so used to feeling a pain point that we stop feeling it. But we need to engage with our empathy, a word we're hearing again and again. Engage with that empathy, let it smack us in the face, let it motivate us and inspire us so that we become curious and we want to find a new way. We've been talking about human-centered design process, and part of that process is doing research, talking to real people who will be affected by the solutions we create in the process of creating them. And not just in research, but in collaborative design as well. Some of the outputs of research could be a journey map, like the one you see here, that enables us to pinpoint peaks in emotion and the interplay of emotion with health status, who they're talking to, and really get at the core of what's going on with this person, what matters most to them. Journey maps can be used as a communication tool to help understand the current situation, but they can also be used to help envision a future state, a better way. A colleague of mine calls journey maps idea experiments. They let us try out different ideas, communicate them, and get feedback. When we're working on specific solutions and products within the organization, sometimes we can be hyper-focused on this one specific problem or solution. But we need to consider the experiences that lead up to that and that happen afterwards, and all of the different entities and people and data involved, and take a step back and consider their overall health journey, not just this one thing, and their life experience. What could happen that should be considered? And when we're looking at the journey, we can look for feelings, because they will get us along the right path toward understanding where we should focus. And we can look at triggers. What are important points for communication or intervention? And we can look at transitions, so life transitions, death, divorce, new baby, moving, loss of job, or health transitions, a new diagnosis, new news, new meds, new treatments, new doctors, or a system transition, a new insurance plan, or too much paperwork, or bills that you don't understand. We can also look at opportunities. So opportunities before the visit to help people prepare, to help reduce their anxiety, to help answer their questions during the visit. How do we enhance their understanding of what's going on, or even provide entertainment or a connection to the outside world? Again, to reduce anxiety. And then how, after the visit, can we improve discharge papers and pamphlets and actually start to guide people through what's to come and what they need? We can also look for patterns. Recurring patterns let us know that some things might be predictable, and we might even be able to prevent them systematically. I think there are 3 types of unmet needs I didn't know. I didn't know I was at risk. I didn't know this was important to my health. And that can be a health literacy or awareness issue. There are so many health literacy programs and community organizations. How can we connect people with those entities and with that information, and how can they connect with each other? Because there's so much value in that connection. Or I know I should exercise more, but I don't have the time, or I don't feel like it. So it can be a lack of motivation that prevents action, and that in and of itself is an unmet need. There are so many behavior change programs out there. How do we connect larger populations to those programs that might be able to help them? And then I want to, but I can't. They've hit a roadblock, an obstacle, a barrier. They've fallen in between a canyon that exists between 2 entities. It may be a lack of resources, money, coverage, transportation, translation services. How do we connect people to what exists that help people get around those obstacles and bridge those gaps? I think in our work we can list out the needs that our patients, that our consumers have, and relate those needs to the entities in the ecosystem, and look out for those needs that not any one entity owns. And I think that we can stretch our services and form new partnerships and figure out how to leverage existing resources so that we can address those needs. We can look at organizations that have shared objectives, like heart health, for example, and brainstorm ways that we can work with them, because again, we're stronger together than we are apart. So great things are happening, but we can do more. For example, patient experience teams, as you know, are focused on improving aspects of the patient experience. And now they're extending even beyond the hospital walls to, like I said, pre-visit, post-visit, considering other conditions. They are even looking at adherence and motivation and behavior change. So they're pushing the envelope farther. And then insurance companies are creating platforms where health and wellness startups can have access to larger patient populations. The insurance company benefits because their members are healthier. And the startups benefit because they have more access to folks. So great things are happening. But I believe that we can do better. I believe we can create an ecosystem focused on care, and that we can do it for Jim and others like him. Thank you.